All right, welcome back to the Active Mom Postpartum podcast. I am incredibly excited to chat visually with Jenna Perkins today. We've worked with each other for a really long time, and this is the first time that we've kind of been able to do a face-to-face. Jenna just opened a new practice in Alexandria, Virginia, Discover Health, and super excited to have you on. Maybe you could share just a little bit about yourself and then this practice that you started.
Awesome. Yeah, thanks. I'm so excited to talk with you, Carrie. And like you were saying, we have shared so many mutual patients over the years, and I feel like we are friends.
Yeah.
And so this is just like a very, very happy time for us to finally be doing something like this. So,
Yeah.
yeah, I am Jenna Perkins. I am CEO and founder of Discover Health. It is a boutique women's wellness practice and really designed to pair my expertise in postpartum and pelvic floor and Urogyn and urology and OBGYN and complex, all of the things that I have learned and the tools that I've gained over the years with my desire to give women the care that they deserve. Um, I am newly postpartum for the second time in 2.5 years. So I have a 2.5-year-old and a 9-month-old, or he's 10 months old now. So I am in the throes of
You
it.
are in it, plus starting a new business, so technically that's your third child
That's my
anyways.
third baby. Third baby. Yep. So I am in it, and really just so excited to be able to create a space that I feel that I deserve as a new mom, and to
Yeah.
be able to extend that same type of love and tender care to my clients. It's just been so rewarding. I'm loving it.
No, I was really happy to see you doing this because I'm like, yay, now they don't have to wait forever to see get good care. So I'm super
Yes.
excited for you. All
Thank
right.
you.
So you've been in like the pelvic space for a while. Like, what are the most common questions that you get from pregnant and postpartum women? Like, what do they come in asking you?
Yeah, for postpartum moms, it's how come nobody warned me
Yes.
that this would happen? And my response to that is a lot of times we just take it for granted, all of the knowledge that we have. And it's just not enough time to explain every single possibility that could
Right?
possibly happen. And then we would scare everyone, right? Like
Yes.
nobody would have a baby if you knew what was on the other side of it. If you have any sense, you would probably
That
be
would be
like,
the end of it.
it would be the end of humanity. Okay, not doing that, not going anymore. And I will also say that even if you know all of the things, like I am an expert in this, and I still had postpartum complications. I still had a postpartum hemorrhage with my first daughter. I
Yep.
really like designed my birth experience. I had a beautiful home delivery, and still ended up almost like bleeding to death after. Right.
Right.
So it's not a whole lot in this experience that you can control. And I think that that is the first lesson in motherhood, is letting go of that control.
I like
Definitely
that.
making sure that you are prepared and safe and know how to advocate for yourself, and have a partner that can advocate on your behalf if you are, otherwise um, obligated doing other things like breastfeeding or trying to survive. So the education piece has to be there, but the horror stories, I don't think that women necessarily need.
Right.
I think that we should explain to women that yes, it can be terrible, but also it can be a very beautiful thing and a very beautiful experience. And as long as you are safe, then you are okay.
Yeah, no, a similar thing with me, and I always it took me a little while to be able to share my story because you kind of, I laminated my birth plan. That puts you a little bit into my head, and I've moved away from that, thank goodness. But like I thought I was being helpful. I was like, oh well, let me laminate this because something might get on it, and this is my
Right.
plan. And really, you know, thinking you're like, this is my day job. I have to get this right. Of course, I'm going to get it right. And then, no, you never had a chance because not everything is under your control. And we live in a
And there is
very,
no right.
no, and there is no right. And we live in a very, I think there's a lot of educated people here, but there's a lot of, and an older mom can say that, we like to control things a little bit, and that sometimes doesn't work.
It never works. It never works. Because again, there are just certain things that are out of our control.
Right.
Like I tried my hardest to have this perfect delivery, and I did a great job of doing the things that I could control, but at the end of the day, I bled out like a stuck pig, right?
Oh
Like,
my
what are you going to
goodness.
do about that?
Oh
So,
my
except for
goodness.
know what to do and know
Right.
when to transition to a hospital and, try to advocate for yourself to get the best care.
And there's
That's what
nothing wrong if that happens. Like, that's good if you have a provider in a home birth that knows, hey, we need to move here. This is going to be a thing. So,
Yes.
yeah.
Yes.
Oh my
Yeah.
gosh.
Um, so that is probably the most common things I hear from postpartum women. Like, how come nobody told me? No one told me that, all of these things could happen. And it's like, well, in a 15-minute visit, you're not going to get all of
You're
this
not
stuff.
going to hit all the things. Yeah. So
Yeah.
what do you see the most? Like, what are the most common issues that people kind of seek care for?
Yeah, so my kind of bread and butter is the complex GYN stuff. So the vulvodynia, the hormonally mediated vestibulodynia. So these kind of hard to treat, hard to diagnose, complicated patients. People are like, I don't know what to do with you, so please go see Jenna.
Right.
Um, and I worked in a busy urology clinic, so of course I saw the overactive bladder, urinary retention, urinary incontinence, bladder prolapse, like that kind of run of the mill. And I'm saying it's, like the easy stuff, right?
Yeah.
But I think that there are a lot of providers out there that are equipped to handle that stuff.
Yep.
But for the more complex, complicated, especially the hormonal pieces to
Yes.
everything, that's kind of like I said, like my niche in within my niche.
Yeah. And I think, in at least in physiotherapy, like we kind of treated it that way as well. I think that's how we connected was I used to do a lot of chronic pelvic pain work, but I was also doing some postpartum stuff on the side. But then seeing actually that a lot of these higher level athletes that, would have prolapse or leakage or things like that actually had a lot of complexities musculoskeletally, hormonally, kind of all these other things going on. I'm like, oh, actually, these run of the mill things are actually just as complicated. And I'm glad you brought up hormones because the thing that I hear all the time from clients, and I have yet to get a straight answer on this, is like, oh well, just stop breastfeeding and it will all go away. Like your prolapse symptoms or your leakage symptoms, and there's so much that these women are told that oh these hormones are so high it's relaxing and everything that I've read is like you get a big drop the first couple months, but there's not that much. And so I tell people, I'm like, I have yet to see maybe like one person in 20 years that had this huge impact after they
Stop
stopped breastfeeding. And who's going to stop doing that anyway, especially with a formula shortage.
it. Right.
So for you, like, what are your thoughts, and what do you tell moms that say, hey, are my symptoms of prolapse and leakage, is that solely a hormonal issue related to breastfeeding?
Yeah, I never say anything is solely, right? It's
That's smart.
probably not just one thing. And working in this complicated space, like I've learned that, it's not just one thing that is causing your leakage. It's not just one reason
Right.
that you have this prolapse. It's usually super complicated, right?
Yep.
Especially with prolapse, like what happened to your mom? What happened to your grandmother? There is a genetic component too. What type of movement are you doing? How are you doing that movement? What type of genetic conditions do you have that might make you more prone to prolapse, right? And so then adding a 10-month pregnancy on top of that with all of the pressure and the gravity, that's just going to make things worse. And so it's really not one thing. And so stopping breastfeeding is not going to cure anything except
Yeah.
maybe the anxiety that you have around breastfeeding, right?
Right.
That's pretty much, there's no silver bullet for any of these things, but breastfeeding and stopping breastfeeding is never just the answer.
I
Um,
don't think so either. I don't think so
yeah.
either.
And even if it is that like your hormones are suppressed by breastfeeding, which is a fact and true, and it can make you have dryness and make you have pain and cause the urethra to not have the structural integrity to stay closed, so you can be more prone to leakage. All of these things are true, but stopping breastfeeding on a Monday, Wednesday, you're not going to have that bounce back, right?
Right.
Your
Right.
hormones are not going to be back to normal. And so, what do we do with that? And so, usually it's okay, well, it's going to take months for these hormones to get situated anyway, if they ever do, right? So, we're going to have to do some sort of treatment anyway. So, why would I stop that connection between you and your baby? Right? Because usually, if they're asking the question and they haven't elected to stop breastfeeding on their own,
Right.
it's something that they want to do,
That's a good
right?
point.
So why would I snatch this experience away from you if it's really not going to be that helpful and we're still going to have to do other things anyway?
Right. Do you ever talk to moms about any sort of like topical hormones or things like that during breastfeeding? Because I've had some that somebody approached them about it, but they're like, "Oh, well, that'll mess up your nursing," and then that freaks them out, and so then they just continue to have like the dryness and the pain with sex and that superficial kind of discomfort that we're talking about.
Yeah, for sure. So the first thing to know is that there are no studies on breastfeeding or
Right.
pregnant women, right? So we just don't have the data for me to give you a straight up answer and say that this
Just
is one
awful.
safe or that
Yeah.
it's going to work, right? So I just don't know. But what I will say is that if you are in to see me, on average, my clients have seen 5 other providers before they see me,
Yeah.
right? So if you made it to a point where you are committed enough to this problem and want to see results, let's make a change. Let's do something, right? So most people are like, yes, it could possibly theoretically impact my supply. But at this point, we're 4 months in, 5 months in, like they're usually
Right.
into the breastfeeding. So drink a little bit more water and let's take care of you, mom, because if you are stressed and in pain and anxious, that does terrible things to your supply.
Yeah, that's actually gonna be worse than probably any hormone impact could ever be. Yeah, is the
Mhm.
stress of not being able to feed your baby.
Mhm. Or
Yeah,
being in physical pain, right?
right. Exactly, exactly, or not be able to have a normal sex life or have discomfort or things like that. Yeah. No, it really is it's there I think you bring up a really good point is like the research isn't awesome. Nobody's throwing research dollars at postpartum women at this point, and we've both been in this long enough to know that it's not coming anytime soon.
Mm-mm.
So we're taking our best guess, but it's a cost benefit sort of thing,
Mhm.
and that's why there's different answers for different people,
Mhm.
and different resources and that sort of thing. So,
Mhm. Yeah, you
um,
definitely have to evaluate the client in front of you, and every patient is gonna be different and at a different point in their journey. But most people, if I give them the data that we do have and the direction that I am used to giving, which is, yes, there are these theoretical risks, but, like, what can we do for you, right? Because you are the client,
right.
I am treating you. How can we get you better? These are the tools that we have.
Yeah.
So let's try it.
Yeah, no, I totally agree. But I think to your point too, I mean, lots of times by the time women have gotten to you, they've seen multiple providers. Ideally, we're trying to change that. I'm sending you some early on these days, and you've been incredibly helpful. Thank you.
I appreciate
Um,
the support.
so for you, because it takes women so long to get answers in some of these complicated cases. What kind of advice can we give women to help better advocate for themselves when they're trying to find answers, a provider that listens to them? Like what are kind of like the signs of, oh, you know what? We might just want to wrap things up here and kind of move along until we find somebody that's kind of going to suit this situation or be able to give me answers. What advice can you give?
Yeah, I would say that, if it's going to take you a long time to get in to see a provider that you trust, right? So, say you have found a vulvodynia expert, but it's going to take you some months or weeks in order to get in, use that time to educate yourself, right? There are books, and I actually have a shop. Um,
Ooh.
and I offer lots of like books and things that you can read to have self-directed learning.
Is that
And
on your
so,
website?
yeah, so
Yay.
discoverhealth.com is my
Okay.
main website. And then if you just want to look for like product recommendations, nursejennarecommends.com.
Ooh, I didn't know about that. That's good stuff.
Yeah. So all of my like lube recommendations and books and all of that stuff you can find at nursejennarecommends.com.
Okay, cool.
So the best way to advocate for yourself is by having that education piece. And so if you have some time between seeing me, usually I can get you in much sooner than, a lot of other providers, but if you are looking to be an advocate for yourself and looking to help your partner or family to give you that support, then read all of the books. Try to do, put your researcher hat on. A lot of women feel like they are not qualified to have access to this information because they don't have a degree. I'm not a
Yeah,
nurse, I'm not a doctor, and this information should not be gate kept. It is
yeah,
your body. You deserve to know what is out there. And so that self-directed learning and the education piece is super important. In fact, the her and Discover Health is for healthcare, what I offer, education, and resources.
Ooh,
And
that's good.
so,
Good
yeah.
mark. Good branding there. I like
Thank
that.
you. Thank you. I've tried to
Yeah.
be as thoughtful as possible, really, in every step of
Yeah.
building this practice to again make it reflect what I think I deserve as a client. Like, what is it that I want to see? What is it that I want to experience as a new mom, and
Yeah.
offer that, extend that to my clients.
So for you, like what were those pieces that, because you were in, you're working for a large institution for a long time, like what was missing in that experience, not only as a provider, but as, a mom, like that made, like what are those kind of pillars that you're like, hey, you know what, I'm going to do it my way. These were the things that were missing. This is what I want every mom to have access to. Like what are those pillars for you?
The biggest thing is time.
Yeah.
Time. You can't get a good diagnosis. You can't give good education. You can't, give good direction on using these resources and tools in a 15-minute visit.
Right.
You just can't do it. It's not possible. It's not fair to providers because, you want to be empathetic and you want to give the best care and you have all of this knowledge and you want to make it translate to every single patient. But when you're seeing 15, 20 patients a day, it's not fair. You can't show up as yourself fully in that type of practice. It's just not possible.
Yeah.
And when you have so much trauma, because that's what it is, right? Related to these different diagnoses for clients, like they deserve space. They have to have space to get comfortable with you as a provider, right? To have all of their questions answered, to be able to have time to be able to learn. And so, really, time is at the core of it all.
Yeah.
So every new patient I schedule for 60 minutes, whether they think they need it or not.
You could probably go longer, right?
Oh my God, yes, you can. And that's
Same
when I'm
here.
like, yeah, I'm like, okay, and we only have 2 minutes left together in our time, but
Mhm.
I would love to see you for a follow-up. And most people are like, okay, cool. When can I come back in? Because I have more questions.
Yeah.
So it's really just time. And I think I got good at it when I was at a busy health center, making the most out of my time. And I had a really good team that supported me, but it still just wasn't enough.
Yeah.
Really, this practice is about luxury, right? So, what's the difference between a luxurious experience at an OBGYN's or a women's health practice and the traditional care that we have deserved? And that luxury, you deserve time.
Totally. Especially moms that are running around and they've got little ones at home or all of that. They deserve that time to sit and breathe and be heard.
Hmm. Hmm.
I, as you well understand with the little ones. So
Yes,
for
I understand.
you, active mom of two, I'm curious, like since you were kind of in this space, what was your expectation kind of going into this as what an active mom would look like, and what's the reality?
Yeah, I really thought that I was gonna be like walking with my baby in a stroller like twice a day and just like pushing them uphill and getting my cardio and like maybe even running with them,
Yeah.
like parking them in front of a TV or something while I hop on the Peloton bike. And the reality is that like that ain't happening, right? The reality is that it's hard to have time, right?
Yes.
Especially if I'm giving so much of myself and so much of my time to other women. It is difficult for me to carve out that time for myself.
Yeah.
And I'm still learning, right? I'm
I
still,
I am too, if that helps, and my kids are 8 and 11, so I'm still learning.
yes, I'm still trying to make it a priority. And so conversations like this are a reminder like, hey, you're showing up for everybody else. You need to schedule some time to show up for yourself.
Yeah. That's
Um,
that's honestly, I almost think that that's 90% of, setting up a successful postpartum is, and I didn't do a great job of this the first time around either, was literally you need to outsmart yourself. You need to figure out what resources you have. That with the exercise programs I give people, I'm like, how little do you need to do so no one dies? Like you need like you will do these exercises because you will notice a change, and when you notice the change, then we can progress, and like, but it can't be this huge list of things, and it can't be, I'll get to it this morning. It has to be, I will go pee. I will go downstairs to the yoga mat that is already set up. I will do these 3 exercises, and once the baby cries, then I will go and get the baby, and then I am done for the day. Like, when that
Mhm.
be like, it has to be like
Bite
that
size.
methodical, but
Mhm.
you have to keep changing it because, as you well know too, you add another baby to the mix, or if somebody's sick, like, you have to be an expert at, like, plan B and C and D and
Mhm.
E and F,
Mhm.
which is a
Mhm.
lot.
Mhm. 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 But you have to have a plan, and you also
Yes,
have to have support, right?
very much so. And
So,
identify and talk to that support and whoever
mhm.
that may be or whatever that may look like.
Mhm. 'Cause
Yeah.
people can't read your mind, and if you're feeling like, "Okay, I really need this from my partner," but your partner has no clue, because they are still in the, postpartum period too. Maybe they weren't the birthing partner and they don't have to
Right.
physically recover, but they still have a lot to adjust, and they have a new normal too, and so you have to really say, "Okay, hey, partner, I need you to show up for me in this way," and you have to be explicit about it
Yep.
and not, put it on them to read what your needs are,
Yep.
because you may not know and they definitely don't know.
Right. No, I think it's hard too when you're trying to still figure that out for yourself to ask for what you need. But at least just, hey, I don't know what I need, but I need something.
Mhm,
It may be 5 minutes. It may be, hey, when the baby wakes up, I'm still finishing my workout. Can you go get the baby while I finish this up because it's important to me? And
mhm,
if I'm happy, then everyone's happy.
mhm, mhm.
Yeah.
Or, I need if I'm breastfeeding, I need for you to clean the bottle parts,
Yep.
It has to, but you have to say that because
Yep.
again, you're figuring it out, and there's an intuitive kind of knowledge that we have as mothers and as birthing individuals, that our body kind of like lets us know certain things, like I need rest, I need whatever. Like your
Right.
body will give you those signs. It won't necessarily tell your partner that for you.
Right, right. And
So you
again,
have
I
to.
don't know that that changes. I mean, we've got a big gap between the two of us, but like I still have continuous heart rate monitoring to know that, I go to sleep sometimes before my kids because I'm like, I am trashed. I need to get sleep. And even my husband, his heart this morning, he's like, do you want me to just take the kids to school? I'm like, nope, I'm going to go run, set up. I'll be back. But thank you for asking. Like that doesn't change just because they get bigger.
Nope, yep, and then the more you practice saying your needs, the more your partner will be able to recognize, like, okay, she needs something. So this
Yeah.
morning, my husband was like, okay, I'm gonna just take one of the kids because this is a struggle. Like,
Yeah.
you take the easy child, I'll take the other.
I
Let's
like
go.
that. You
Mhm.
you take the easy child. What we should just create like a little sign or a t-shirt or something. You take the easy child today.
Yeah. And
Awesome.
luckily, it's always at least one that is like, okay, I'm gonna give you a break, mom. They
That's
they
good.
like to take turns.
They do. I think that that's pretty consistent. When one is a pain, the other one's not so bad. So good.
Yeah.
Yeah, no, that's good. That's good. That's good. All right. Awesome. So you can find Jenna on Discover. I keep wanting to say Discover Her Health, but it's Discover
Everyone does.
Health.
Yes, it's just Discover Health. Yep, Discover
Discover
Health.
Health. You can
Yep.
find her there. We can find her on discoverhealth.com. And what was the other website? It
Product
was
recommendations are nursejennarecommends.com.
awesome. Awesome. And you've got this Instagram started up now and you're putting some good information out there. So I'm so happy to kind of see you out from the institution and get to see your personality a little bit. And
Yeah,
you've always been amazing with all of my clients.
thank
So
you.
I'm so excited to see you out there and kind of giving your good care and your great advice to
Thank
women. I
you.
really am super excited for you.
Well,
So
thank you for being an example in this space of what it means to be stellar, and I appreciate that example for sure.
oh, thanks. Thanks. Awesome. Well, thanks so much to be on, and hopefully we'll meet in person one of these
Soon,
days.
soon, soon.
All
Even if it
right.
has to be a play date.
Exactly. Exactly. Babysitter. All
Yes,
right. Take
exactly.
care.
Bye now.